Hello and welcome to the Private Room, exclusively for readers of the book, A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity. And we're very fortunate to have with us Jody Bilstrom, licensed clinical social worker.
Hi, thanks for having me.
Now, I know we mentioned this in the book, and I've mentioned it before in my videos, but I really think as the expert in reversing and preventing all autoimmunity in your community, that you very much may want to consider having an LCSW in your clinic. The first functional medicine clinic in the US associated with a teaching hospital required everybody to see a nutritionist first. Our clinic, as the second in the United States associated with a teaching hospital, asked everybody to see the licensed clinical social worker, the counselor, because it is so important to optimize stress management. And as you're going to find out, there are so many people that have experienced adverse childhood events, and it's profoundly important to be able to help them if that still is an issue. And that's why, another reason why I'm so happy to have Jody here. So Jody, could you please tell us about adverse childhood events, the 10 adverse childhood events that tend to need to be addressed?
Oh, of course, and they are incredibly important to address, especially in a young person's life that have been sitting with them for years, and this trauma that was never dealt with. So ACEs is the acronym for adverse childhood events. And these are events that occur in a young person's life that have serious negative impact on their health as years go by, which we see every day in our clinic. So it is important to know if these events have occurred, and thus we want to screen for them. So I'm going to go ahead and read right off the screening form that I use with every new patient, the 10 adverse childhood events. And I'm going to read them because I want to make sure everybody understands what they are. It may sound kind of brutal or very direct, but that is one of the key pieces, is that when I use these screening forms, it helps me and the patient also know that this is actually a trauma that did occur. Sometimes I'll say, well, were you sexually abused or were you physically abused? Oh, no. But when I get very specific about what may have happened, then I find out yes or no. So this is why they're so direct. So I just wanted to say that first. So the first one, number one, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid you might be physically hurt? So that one's physical abuse. Oh, I'm sorry, that one's emotional verbal abuse. Number two, did a parent or other adult in the household push, grab, slap, or throw something at you, or put a mark on you, or any kind of injuries? Physical abuse. Number three, did an adult or a person at least 5 years older that was in your household ever touch you, fondle you, or have you touch them in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Sexual abuse. Number four, did you often feel that no one in your family loved you or thought you were special or important, or that your family didn't look out for each other? Emotional neglect. Number five, did you often feel that you didn't have enough to eat, had enough to wear, or dirty clothes? Did you often feel that your parents were too drunk or stoned to take care of you? Physical neglect. Number six, were your parents ever separated or divorced? Parents divorced. Number seven, was your mother or stepmother often pushed, grabbed, slapped, or had anything thrown at her, or sometimes kicked, bitten, hit with a fist, or something hard? Was she ever repeatedly hit over at least a few times, or threatened with a knife or a gun? So that one is witnessing mother's abuse. Number 8, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Parents' substance abuse. Number 9, was a household member depressed or mentally ill or ever attempt suicide, family depression, or mental illness? And number 10, did a household member ever go to prison? So a parent's incarceration would be number 10. So it is really important to understand if any of these things occurred. And for the scoring, it's 1 point for every trauma that they experienced. And it's very important to understand that if there is a score of 4 or more, so if at least 4 of these traumas occurred in their childhood, they stand a 70% chance of developing chronic illness in adulthood. So staggering number, and how it affects them and their health.
Well, thank you for running through that. And I think when you list it as you did, and the detail of each one of the 10 is, it might surprise our nurse practitioners, our readers, that how common this really is. I mean, I got to tell you, when I go through my health questionnaire, and the health questionnaire that we're going to share for the nurse practitioners who are the experts in their community in this, is they'll be, I think, blown away by the number of people that check multiple boxes on a very simplified form, let alone when you get into the detail like you're talking about, how it really turns out there was that, even though they may not check it on the health questionnaire. And it's really almost uncommon to find somebody who didn't have any one or more of those happen growing up.
Well, we've noticed that in the clinic, that so many of our chronically ill patients, in particular autoimmune disease, usually have some type of trauma. But the other part of it too is that, some of these health questionnaires, there's a lot of shame involved. They're embarrassed. It's scary to let out this family secret, and it's scary to think about or to admit that this has happened. And so with that, they carry a lot of shame. So it's really helping them to also realize this is to help them. This is to help them feel better. We need to get to the bottom of all this.
When I go through people health questionnaire with them on the first visit, and we go through things in general, I really try to explain to them what all the symptoms mean and the significance of things, whether it's C-section delivery, not being breastfed, having allergies and asthma and eczema, recurrent infections, well, there's that dysregulation of the immune system. I talk about cortisol, the stress hormone, how good it is at throwing off all the other hormones. And then here's menstrual stuff, and probably cortisol is off throwing off menstrual stuff. But I'll put in there, because I think it's important to mention it. And we don't want to just gloss over things and not mention it. Is I'll say, and when I see several adverse childhood event questions check, I won't go into detail with them with this. What I'll say is, and the adverse childhood events, create a lot of cortisol issues, stress issues, that then can create these other hormone issues. And when cortisol gets thrown off, it's hard to get rid of inflammation and all this. And so I'll acknowledge the presence of the adverse childhood events, but not try to put them into any kind of uncomfortable position that they feel like they have to discuss the details of that. I just recognize it, basically acknowledge it the same way I'd say, hey, you got bad menstrual flows and PMS. Hey, you got insomnia. Hey, you got right knee pain. It's just nothing that really requires a lot more attention in the first visit, but it just needs to be recognized. But also, I think it's important to recognize, for the patient to recognize, that we do address the underlying issues, and but not that is necessarily the most important thing, and not that we're going to really focus on that in our visits, but it's something of importance, just like C-section, early use of antibiotics, recurrent use of antibiotics, but acknowledge that that's something that's important and part of the big picture.
Oh, definitely. It also, like you're saying, it also helps, and we'll talk about this a little more today, but helping them realize that this stressor that's been sitting with them since childhood has impacted their health. And so we need to work through this so we can reach optimal health for them. And that is important that the face of medicine realize and turn towards counseling, individual psychotherapy for this reason, to help their patients feel better faster.
And I think they appreciate that is mentioned as part of it, and they don't feel threatened by the information that they shared. And I got a lot of people that goes, "Oh yeah, I had a messed up family." I used to sing like that. I was like, "Oh yeah, I don't." And we see the adverse childhood events. They go, "Oh yeah, my family was totally screwed up." And they're happy to
They
talk
know it.
about it.
Yeah, they know it coming in, and we all, laugh and say, who doesn't have a messed up family, to try and normalize it a little bit so they don't feel so self-conscious and that shame doesn't take over. It's really trying to normalize it for them.
And even patients that don't have any of those checked, and I ask them specifically, nobody in the family, when you're growing up, wasn't any divorce, separation, substance abuse, incarceration, and they'll say no, and I go, it's almost unusual for that not to happen to somebody, even to acknowledge
Exactly.
it, and to people that didn't have that occur. I think it's important that they know that is important stuff. And there's a lot of people out there that have had that occur.
Oh, very much so. It's really, I can't even recall the last time somebody has had none of these things, or even, within the family history. Yeah,
It's super
there's
common.
usually something.
Well, if you would, so talk about what kinds of health issues occur, as these events are occurring, or as an adult, kind of driven by the changes in the body that come from the experience of the adverse childhood events.
Oh, sure. Well, first of all, it's important to remember that the higher the ACE score, so our adverse childhood events, the more traumas, the higher the ACE score, the worse the adult outcome. So we have to remember that first. So these percentages are for ACE scores of 4 or more. So with that, there's twice as likely to become an alcoholic, 6 times as likely to be diagnosed with cancer, 2 times as likely to be diagnosed with heart disease, 4 times as likely to be diagnosed with emphysema, and 12 times as likely to have made a suicide attempt. Huge number, 12 times as likely to have attempted suicide. So really, this is just the tip of the iceberg, where, it's just the beginning of all the chronic health problems that can occur. So it's really important to also spell that out, give them a lot of positive feedback and acknowledgement for coming in, for finally taking care of some of these issues, because these are big numbers and how it affects their overall health. And the one that jumped out to me, of course, was the 12 times as likely to have made a suicide attempt. So very important to address now.
Yeah, and to that point, if you would, why is it so important to ideally, address these issues before age 19?
Because yes, so addressing before the age of 19. So, with these behaviors, with these ACEs, there are a lot of risky behaviors that can occur because of these adverse childhood events. Smoking, illegal drugs, excessive alcohol use, running and being around people that are in that world. So very high risk. And so those things alone can just lead to chronic health issues. But as far as the importance of studying the genetics before the age of 19, so epigenetics, turning on the good genes, turning off the bad genes. If we set the epigenetics by the age of 19, they do not get the chronic health issues as an adult. So these ACEs, these adverse childhood events or traumas, severely impact the stress hormone called cortisol, severely. So if we can catch that before that stress sits back in the, that unconscious brain and wears them down slowly, carrying that kind of stress for decades is such a burden. So if we can change that for them and help them intervene before the age of 19, try and get this cortisol addressed and turn the good genes on, turn the bad genes off, such a better outcome overall. So the cortisol, what happens is the cortisol gets stuck in that on position that, we hear of the fight or flight or the bear chasing you through the woods, and that's stuck on. So once they're stuck in that fight or flight, it's very hard for some of them to even feel stress. They are so what we call hypervigilant. They're always looking, always on guard, to the point that stress has been there for so long that a lot of patients that I work with by that time, decades of this, they don't even sense the stress. They don't realize how stressed they are. They don't even sense danger or fear anymore. The cortisol is so off kilter that they have a hard time sensing danger, risk. They have been thinking that way for such a long time. So this is very, very important to change this if we can before age 19. It affects their stress levels. It affects their chronic health, chances of not having these illnesses.
Well, thank you for bringing up all that information, but the epigenetics as well. In the book, I just briefly touch on epigenetics, and I'm glad we got a chance to talk about it just a little bit here, and we'll talk more about it in the advanced scientific course that will be a part of this whole changing the way autoimmune disease is managed worldwide here. But there's a lot of bad genes, a lot of good genes. Got to turn off a lot of the bad genes. Actually, 7 to 8% of the human genome is viral. So over the eons that humans have been in existence, viruses have tried to jerry-rig our genes, put their genetic material into our genetic material so that we produce proteins to make ourselves sick. We got to turn those off, but also there's so many bad genes on the X chromosome. And women get 2 X chromosomes, guys get 1 X, 1 Y. And for a woman to be optimally healthy, she has to turn off 85% of the second X chromosome, almost totally shut down the second X chromosome in order to be optimally healthy. And you can imagine that's a lot of work. And what we know about epigenetics is that, ideally you want to set the system by 19, and we've known that for a few years. And then now with all the adverse childhood event information, it turns out such synergy that it turns out, hey, you want to address this by age 19 because of epigenetics. And I think that's just a beautiful thing between the physical and the cognitive, emotional. There's that synergy where you want to set it by age 19. And then after that, ideally, you want to set it before conception, if at all possible, because then you pass on cleaner genes to the next 4 generations.
Yeah.
And so they talk about people living the trauma of past generations because of this whole epigenetic thing.
Exactly. I mean, you can see it in family histories. And so being able to help a woman in particular reset this, so future pregnancies, future generations, we can stop the cycle of this. And so it is crucial to try and do this by 19.
But if I give an example how people don't recognize the stress, is so prior to moving where we did to really try to change the way autoimmune disease is treated worldwide, where we lived in Chicago, and on the health questionnaire that you nurse practitioners or the experts in your community can have patients fill out, there's a 1 to 10 section for several things, including worry and anxiety, and actually 0 to 10. And so I'm thinking our world is so crazy stressful, nobody's better under 2 to 3. So most people are in the 5, 6, 8, 10, 9 range. Every once in a while, somebody comes in with a 0. So back in Chicago, when people came in with a 0, I'd say, hey, worry and anxiety, because I go through the one right above it is energy, 1 to 10, and they give a 4, a 3, or a 0, So then I say, hey, worry and anxiety, you give it a 0. So I said, is there anything particular you do to, help manage stress? I like to go for a drive. And I go, now you're telling me in Chicago to relieve stress, you get in the car and drive? Now, there's a lot of adjectives that you could use to describe driving in Chicago. The one you can't use is relaxing.
No, not on the expressways. You could never do it during rush hour. That would create road rage. So talk about pump up the stress level. I can't believe it would take them an hour just to get out of town, to be able to hit anything that would even resemble a peaceful drive. So there's nothing peaceful about taking a drive in Chicago, never. So out here in Idaho, it's different. Yes, driving is really gorgeous. It's wonderful mountains to look at and beautiful scenery, but no, not in Chicago at all. You want to avoid it if anything.
So we tend to be, allopathic medicine in general, and it's in this nation, but kind of worldwide too. We tend to be sort of a pill for every ill, quick fix kind of cultures nowadays. Can you kind of talk about how medicine really can't fix this, but why we kind of get stuck in the downside of that?
Yeah, it's a good question. It's a question we always wrestle with. And I tend to have a real love-hate relationship with medicine. And so I'm dating myself, but back in the very early 90s, even late 80s, when I was practicing, or starting out to practice, that's when the Prozacs and the Paxils came on the market. The pharmaceutical companies developed these antidepressants. And so as a mental health professional, you thought, oh my gosh, this is the answer. This, they touted these as the miracle drugs. And they were very helpful for certain things at that time. So we thought. And so, I have to say that one of the only times that I am okay with prescribing an antidepressant or an anti-anxiety for a trauma survivor is when it, like from war vets to young moms that come in our clinic to, 70, 80-year women, they're trying to get their health under control. Some of the only times that it really is helpful is if they are struggling, acute situation, they're struggling, they cannot get any sleep. They have a really hard time controlling their emotions, the trauma. We're trying to work through some of this trauma and it's so intense. They're they become a slave to their emotions while they're going through this. I can see that it is really wearing them down. So medicine is helpful in those very short term. And when I say short term, I'm talking like, 6 months, just a very short term trial on these medications. But I would rather do that than some of the things I've seen before where they will look at using alcohol, using illegal drugs to finally get to sleep. There are so many, some talk to me about nightmares and flashbacks and night terrors that they can't sleep. And so to be, sleep is healing. And so to be able to help them get some sleep for a short period of time while we are doing some work in counseling to get some of this under control has been helpful. However, so I'd rather have that than have them abusing alcohol and using illegal drugs, of course. So short term for that. However, a big however, today now, back, this started in the late 80s, early 90s. Now today we realize that those medications can do more harm than good. So it is much like that saying, putting a Band-Aid over a bullet hole. Band-Aid over a bullet hole. You have to think of that. Meds may initially help, but ultimately they suppress the emotions. So it is the real issue, the trauma never gets dealt with. So again, you're looking at it as the bullet hole is your trauma. And if, it's caused all this internal damage, but we have to address the bullet hole. We can't keep putting the Band-Aid, i.e. medicine, over this bullet hole. We're suppressing the emotions. We're not feeling those emotions. So once we see that they're getting some sleep, they're calming down a bit, they're more involved in their lives, they're managing their lives a little better. Then we can look at, okay, we can start decreasing the dosage of the medicine and eventually get them off. And then they are dealing with these emotions, the traumas, much better, much more effectively. So very important to understand that. I've always had a really hard time with medications, but in rare instances, it does help. And then after we're able to implement some more in counseling, work through some more of these emotions, help them deal with it, then we can start to decrease the dosage of the medicine and finally get them off so that they are sleeping. So with that though, I want to say the other thing we're doing, if they are on a short-term course of medicine, or if not on medicine, but what I do in my office is implement other treatment modalities that I find to be essential to dealing with trauma. And so some of those are, of course, the first one being individual psychotherapy or counseling. Very important to come into counseling to help begin to deal with some of this. Neurofeedback, biofeedback, wonderful. Yoga, guided meditation. I do guided meditation right in my office to help patients learn relaxation techniques. Music therapy, EMDR, acupuncture, all of these help calm the body down. So teaching these relaxation modalities are so important. Yoga, deep stretching. I'm not talking yoga like hot rocks, standing on your head yoga. I'm talking about stretch yoga, flow yoga, which is really a guided meditation while you're doing the yoga stretching. Very important to calm the cortisol, help reduce these difficulties that they're experiencing in their daily life, help calm this so they can cope day to day. And slowly then, if there is a trial of the medication, slowly wean them off of it while bringing in these treatment modalities. Crucial to dealing with trauma.
Well, thank you for sharing all that. If I could just make one more comment about why I think it's so important that people potentially consider having an LCSW or a PhD level psychologist in the office for this stuff is historically, before my clinics, we said everybody's got to see the counselor at least once, is I would talk to people about how important this stuff is. And I go through this, and then they go, well, I'm not crazy. I go, well, no, I know you're not crazy. But I'm just saying, epigenetics and adverse childhood events and stress and cortisol. Well, I'm not crazy. No, I know you're not crazy. There's such a stigma when it comes to mental health, unfortunately, that, this is what I've figured out eventually is I'm just going to say everybody that comes to see me, and ideally the nurse practitioner who's the expert in reversing and preventing all autoimmunity in their community, but also chronic disease in general, is really consider, when you see me, you got to see the counselor at least once. If that's the only time when you guys decide that's cool, that's all you need, great, fine. But everybody's got to do it because it's so important to be able to optimally manage stress. Is kind of the verbiage that I tend to use, and reset that cortisol, because if we can't reset the cortisol, the body can't heal. The body just doesn't heal when it's stuck in this fight or flight mode. We gotta, get rid of the physical stressors that are locking in, but then you've been here so long, your body forgets what this feels like. So we gotta teach it. And this is where the counselor comes in. We got to teach your body to get here. And it goes, oh, that feels so good. I can fix anything.
Oh, it is crucial. It really is important. And I know in our clinic, it is really important to meet everybody, because just like you mentioned, oh, I'm not crazy. That's not what we're talking about. And that's not crazy. When you've been a survivor of trauma, the impact it has on your life. They will even say to me, well, I started to feel crazy. because they just didn't know what to do with all these emotions. It was too intense. And that feeling, so then they get guarded and they don't want to talk about it and they're defensive. But we try to normalize it. And by even having the screening form first to kind of introduce it. And then when I meet them, really trying to help them understand that this is to help their physical health as well. And they're going to see so much better and faster results if we finally take this on. And it really de-escalates even, their fears, their shame in it, bringing it forward. So that feeling of crazy, I understand that they're dealing with all these intense emotions, but we have to help them with that. In all clinics, this should be something that is addressed because everyone struggles with it. It is what we're seeing is more, like you mentioned, more than not, we see trauma in childhood. So very important. We can't ignore it anymore.
And I think an additional trauma in the population that we're talking about, the autoimmune disease population, it's been 4 to 5 years of searching multiple practitioners before they even get the diagnosis of autoimmune disease. And unfortunately, women have been told, well, I think you're just depressed. And if you got like 9,000 things going on at the same time, it's going to bum you out, but it's not why you're feeling this way. And so it's such a terrible situation and a feeling of like, well, maybe I am crazy. By the time they actually get to the expert in the community that knows how to reverse and prevent autoimmune disease and why it happens, you can tell them, well, this is why it happened. I can say it started, at 2 years of age. I can see those antibiotics you did 10 times in a row, and there's trauma in just trying to find somebody that knows, what's going on being diagnosed, and then a trauma of trying to find somebody that knows how to fix them rather than just slapping meds on them. They're kind of traumatized by the time they come see us because of that too.
Oh, that happens every day. Every day I hear that story in our clinic from someone that they saw different specialists, different doctors in the community. They were basically told, well, you're probably depressed, or you're doing it for attention, or you're making it up, or you're a hypochondriac. And when they begin to even try to talk about the mental health challenge that goes along with it, they are called lazy. They don't want to work. Oh, you just want to be on disability. I mean, horrible things are said to them. And they're really so sick, exhausted from decades of feeling awful, decades of keeping this stressor of this childhood trauma under wraps, hidden, not addressing it. By the time they do get to us, they are completely exhausted. And really by then are welcoming anyone that will talk to them about this.
Thank you so much. And appreciate you sharing your expertise. And once again, everybody, like the song says, and like the book says, got a revolution, got to revolution. Thank you so much.
Thanks for having me.